On the day of the symposium, the presenters will have been talking about cancer as a chronic illness with which a person has to live over time, and one that is characterized by crises or acute times. Will you share with us how it has been for you since your diagnosis with breast cancer in January of '81?
Well, I'll start with a brief history. In 1981, I had a mastectomy, right breast, 10 of 24 lymph nodes involved, and I began a regimen then of CMF for 6 weeks. It's Cytoxan, methotrexate, and 5-fluorouracil. In April 1982, I had more fibrocystic disease in my left breast. At that time, I had a prosthesis in my right breast and was playing softball consistently, and found that it got to be a big nuisance as I would run around the bases.
People thought you had a heart attack.
People thought I had a heart attack because I was always clutching my chest. So when the doctor said, "You have fibrocystic disease," I said, "Take the damn thing off." So he did, and I had a prophylactic mastectomy then in 1982. In May 1982, they found a malignant wall in my right, a malignant node in my right chest wall, and I went to have radiation for that. In August 1982, there were mets to the lumbar spine. At that time, I went down to MD Anderson in Houston for a second opinion. The doctor down there started me on Megace and then tamoxifen because I had an estrogen level of 35 and a progesterone level of 19.
Those are high, aren't they?
Yeah, those are high. And they're also, when they're high, they're supposed to respond to this type of therapy. And I went for that therapy because it was, well, they had relatively few side effects, and so it seemed like an easier thing to do than the chemo. But when I went back then in December, we found that the hormone therapy wasn't working, and I went under radiation for my back again because
you were having pain at that time?
Yeah, the hormone therapy wasn't working. So in February '83, I went back to Houston for another checkup. At that time, she found cancer in my liver. There was over 80% involvement in my liver at that time. So they recommended that I have an intrahepatic, which I did in March, and I'll talk more about that a little bit later. In April '83, the scans were clear except for a small tumor in the right lobe. The doctors decided at that time that it was a different genus, and so they switched the chemo to Velban. Then through '84 and '85, I've just been holding my own, having had various courses of chemotherapy, radiation, up, down. Some scans are good, some scans are lousy. It just sort of depends on the day.
How is this day for you?
This day's pretty good. Yeah, I'm doing pretty good. So in conclusion, to answer your question about how it's been for me, it's been pretty crappy. I really didn't mind quitting teaching, but I didn't know exactly what else I was going to do. Because I'd been teaching for about 15 years. So I wrote a book. I went fishing a lot. I worked on cars. I fixed stuff. Just did a lot of things that I kind of been wanting to do.
You bought a Jeep?
I got a Jeep. Yeah. It was also a time when my friends were really important, especially the Sisters of Loretto. For example, after the mastectomy, the first mastectomy, Sister PJ moved in with me and cleaned and cooked and just sort of took over everything for me. When she left, my friend Barbara was always there, still is. And then in December, Marianne moved in with me, and she's been sharing all my problems, my ups and my downs,
ups and downs
since then.
Gosh, that's quite a history, isn't it?
Yeah, it's quite a history.
Well, when you tell it in a history like that, I wonder if there are times that stand out in there as what you would call crisis times, really turning points for you.
The whole thing has been a crisis. But if you want to take one particular time that really made a significant difference, I would say it was when I had the catheterization of the liver. The doctor in Houston is the one who recommended that, and I decided to wait until I got back to Denver to have it done. The problem was they had never done that kind of a thing before in Denver, which they didn't tell me. So when I went into the hospital in Denver, they said, "Oh, it'll take probably, you'll be in the hospital probably about 5 days." Well, do you know how long I was in the hospital? No. 15 days. I'll tell you what happened. First of all, doctor, it's called an angiogram, and the doctor tries to thread my vein with a needle and go into my liver. He couldn't get it through the vein. He tried 21 times before he could get it through the vein. And you're totally anesthetized. I had a little bit of Valium. But finally, I said to him, I mean, as doped up as I was, it wasn't enough. And I just said to him, you've got one more chance, and that's it. This is my body, and it hurts. So he called for his partner, and his partner came in and managed to get the vein threaded and the intrahepatic in there the first time. Now, I was angry, yeah, because all you had to do was ask. You know, I don't like arrogance.
No.
I didn't like that at all. So anyway, that was not an extremely helpful situation. It was not a good place for me to be. And but after that, the reason I say it's a crisis because it was at that time that I decided that if anything was going to happen in my care, I was the one that was going to have to do it. If you people make a mistake on my body, I'm the one that it hurts. It doesn't hurt you, but it hurts me a lot. So that was the time when I decided that I was just going to have to go do things on my own. And that's why I call it a crisis. My doctor in Houston said to me before I came back to Denver, she said, Annie, whatever you do, don't let them treat you like you're terminal. And I have been operating on that. I say to every doctor I meet, I am not terminal. I don't care what your statistics say. I am not terminal. If you start treating me like I'm terminal, I go somewhere else. So that, I think, is a pretty important lesson that I've learned.
It sounds like you've lived each day.
Every day.
Every day.
Some better than others. Anyway, after that, I was in and out of the hospital a lot. I had a Hickman catheter inserted and went out to play ball again too soon after the Hickman. And, of course, I got hit in the chest, and that caused the pulmonary embolism. And so that whole summer was in and out of the hospital. I had 2 PEs, and then I got an infection secondary to the Hickman.
What'd you do for that?
Oh, they gave me, I can't remember the name of the drug right now. It was Klebsiella. It was a Klebsiella infection. And I told him I wasn't going to stay in the hospital for as long as he told me I had to stay in the hospital.
You had other things to do.
I had other things to do, so he arranged for me to take the big jug with me. And I can remember being up in the mountains fishing, and we hung the IV from a tree, and it dripped down into me, and that was the way I got my...
And you got well one more time.
I got well one more time. Back on the field again.
That's great.
So how did I get through those times? I'd have to say my friends. I always knew I was going to get better. There was never any question in my mind that I was going to get better, and they just reinforced that by not letting me stay sick. So.
So your friends have been important to you through this time?
Oh, absolutely.
Well, have there been changes in those relationships, changes in relationship with your family or friends that would have been a source of struggle for you, or would you say they generally have been a source of comfort and support?
Oh, definitely comfort and support. There's never been any history of cancer in my family, and so it was a big shock to everybody in my family because I was probably always thought of as the healthiest person in the family. In terms of being outgoing and athletic and everything, so it was a big shock. My sister in Denver was wonderful, and she brought me cheesecake in the hospital, and we'd never been very close, but it was a good time for that. Elaine, who's my sister, and I down here, we'd always been pretty good friends, and that sort of cemented that relationship. My brother and his wife had Christy, who's my daughter, and I'll talk a little more about that later too, come to Phoenix to live with them. But it's been my friends consistently who've made the difference. And I don't mean things just like sending cards and calling, although there were thousands of those. And they would do really caring type things. They just don't quit. I mean, my friends, if I'd get down, they call me and say, "Hey, Annie, we've got too much invested in you." If I get depressed, they say, "Come on, Annie, let's get out of this now." I say, "I have a right to be depressed. You know, if you had cancer, you'd be depressed too." They say, "You can be depressed. You've got 15 minutes. So be depressed and get it over with." And that's kind of the way things have been going.
Oh, that's a wonderful story.